Hi, welcome to the Unitarian Universalist Women's Federation program, Reproductive Justice, Rising to the Challenges. I'm Claire Sexton, the president of the UUWF board, coming to you from Waco, Texas on Monday, May 18th, 2020. I think it's important for us to situate ourselves in time at this moment in this strange circumstance. Partly because of that, we've changed our workshop quite a bit now that GA is virtual. Even before the decision about GA being virtual was made, one of our board members, Betty McCollum, who had done the bulk of the work on putting together this program of national leaders in reproductive rights, died of COVID-19 in New York City in April. And so we dedicate this program to Betty and her family. And with this change of format and timing and overall circumstances, our original presenters were not able to offer their planned program. I'd still like to thank them very much for their willingness to join us and to make sure that you, our audience, are aware of their work and their organizations, because they really are fabulous. Sunu Chandy is the legal director of the National Women's Law Center, where she oversees the center's litigation efforts, providing strategy across the National Women's Law Center to create better outcomes for women and girls at school, the workplace, and the healthcare sector. Lexi White is the senior policy manager with In Our Own Voice, National Black Women's Reproductive Justice Agenda, which is a policy initiative in partnership with Black Women for Wellness, Black Women's Health Imperative, New Voices Pittsburgh, Sister Love Incorporated, and Spark Reproductive Justice Now. We'll put some links on some slides in there for you for both of those. And I won't go too much into the Women's Federation's history as an organization, because we'll touch on it a bit in this workshop as it relates to reproductive justice. And because we're in the middle of changing that history now, we're doing some strategic planning and combining with Unitarian Universalist Women and Religion. And I'm so happy to have a very different panel today, a variety of past presidents of the UUWF. I'll introduce them briefly, and then they will each take some time to talk about issues in reproductive justice in the US, from Roe v. Wade up through the more recent and encompassing reproductive justice movement, which of course goes further than abortion rights. First, I'll introduce Gretchen Oman, who is on our board and running tech today. You won't hear much from her, but I wanted to acknowledge her contribution, and you might see her. Arlene Johnson was president of the UUWF in the 1980s. She joined the board right as Denny Davidoff was rotating off. She was one of our more distinguished past presidents. And Arlene has been active in women's justice both before that time and since, more recently serving as the board president of the International Women's Convocation. Lu Burciaga is also a former president. I guess I don't need to be saying that because we all are at this point, who lives in Massachusetts, and you were president in the 90s, I want to say, but she can correct me when it's her turn. And then immediately following Linda Lu was Marti Keller, who's on your screen. And Marti, after her time as board president, also served with the UUWF as our minister for the organization and led our policy agenda and really did some great work. She was on board when I first came on. I joined in 2016, became the president in 2017. So with that, I will let Arlene go with her agenda as it were.
Thank you, Claire. I guess I would like to start with my background in reproductive issues. Probably dates back to the early mid-70s, and it was pretty grim back then. It's easy to forget, certainly today, that there was absolutely no birth control pills or legal abortion. At least there was no there were no pills until the mid-60s, and abortion was not legal until 1973, when Roe v. Wade was passed by the Supreme Court and definitely made abortion legal from that point on. But what's interesting is that since the passage of Roe v. Wade by the Supreme Court, back then women had 8, 9, 10, 11 children with no birth control. They couldn't afford them. They weren't able to feed them. And so they turned to desperate means. They used all kinds of instruments to abort, including coat hangers. I mean, that's the famous one where people remember coat hangers were used. But many women died because of those botched abortions, and sometimes it's not remembered today that this is what happened to women who did not have access to legal abortion. I think the other thing that I wanted to say was when Roe v. Wade was passed in 1973, over the years since then, there have been many organizations that have sprung up to fight against legal abortion, and they have done everything in their power to work legislatively and to try and stop abortion. They're vigorously fighting it even to this day, wanting to outlaw abortion, wanting to close clinics, even going as far as bombing clinics and killing some abortion doctors. We know that that has happened in recent years. But the latest tack is to use the excuse of COVID-19 to stop abortions in several states, mostly in the southern states. And in Oklahoma, Tulsa, where I live, that is definitely, the legislators are trying their best to say, well, abortion isn't an important issue. We don't need to have abortion when we have to fill the hospital beds with COVID-19 patients. And they try their best to come up with laws to close the clinics. One of them, of course, we all know, is that they demand in many states that doctors who perform abortions have admitting privileges to hospitals. Well, that's great if they do have admitting privileges, but in many states that's not possible because many of the hospitals do not allow abortion anywhere near their hospital, don't allow doctors who perform abortions to be part of their hospital. So, but we do have to thank Sarah Weddington, the young lawyer in Texas, who fought the for us at the Supreme Court. And she was just a brand new lawyer out of law school, I believe at the University of Texas. And she worked long and hard to get that case before the Supreme Court. One thing that I do want to mention is the important role that the UU women at the First Unitarian Church in Dallas played during this time. They volunteered with Sarah Weddington. They worked with her, helped her prepare her case. And I don't want us to forget that the women from First Unitarian Universalist Church in Dallas played a major role in volunteering and helping behind the scenes. Anyway, those were some of the points that I wanted to make. I may have other comments to make later. Thank you.
I wanted to make a quick note. I saw Sarah Weddington speak in the late 90s. And if I'm not mistaken, her time in the Supreme Court building, that was her first courtroom case. She was that young. Like, she was a brand baby new lawyer when she argued that case.
Mm-hmm, mm-hmm. Very much so.
Right. And so, speaking of courts, Linda Lu.
Well, first of all, a couple things. You probably cannot see this, but on my kitchen counter, it's been there for over a year, is a stick pin of a hanger to remind me and everyone else that what is happening in our country today to restrict women's choice. That's the first thing I wanted to say. Second of all, I wanted to say that as a career with 40-year social worker, I did accompany teenage girls who needed to have an abortion. And so I always wanted to counteract the notion that this is a willy-nilly decision, and that is not correct. These young women were terrified. These young women were in pain. They knew they made the right decision, but that's something that's always been important to me as a social worker. One of the things that I've been looking into, knowing about the Supreme Court case that is coming up, I wanted to get a little bit more detail about it. And so I also want to apologize to anyone attending this workshop who is a lawyer or who has legal background, which I do not have. And I'm hoping that I will be explaining what I've learned correctly. As we all know, since Donald Trump was elected president and his current administration, there has been a turnover in the Supreme Court. We have lost 2 members, and the 2 members that have been appointed by Trump, which is Kavanaugh and Gorsuch, it's a scary time. I know one of the things when we talked in the past, we said, do we have hope? I have to keep that in my mind and in my heart, that there still is hope. There have been a flurry of lawsuits because of the COVID-19 crisis, where about 8 states are trying to reverse some of the Roe v. Wade issues by using the emergency powers of the pandemic, saying, oh, well, abortions are elective, they are not an emergency medical issue. So one by one, I know that the Center for Reproductive Rights has been fighting state by state some of these cases. And I'll give you a couple examples. And one is the example in, let me see, I think it was in Texas. But one by one, they are working on getting the courts to agree with the pro-choice side and saying that that we cannot shut down abortion clinics by saying that they are not an emergency care. It still is an emergency situation for a lot of women. So thanks go to that organization for stepping up to the plate. Regarding the Supreme Court case, which has, they are hearing the arguments. I now know that the case will come, it will be coming up. They have agreed to hear the arguments. The case will be coming up in the winter. Of course, now we know what else is coming up in November, and that's an election. But at the moment, the case is supposed to come up in the winter, with the ruling probably coming down early next summer, meaning summer of 2021. The current case that is coming before the Supreme Court is the state of Louisiana, which is now, they are saying that doctors have to have hospital privileges to be able to perform abortions. Now, presumably this case was settled in 2014 when Texas brought the identical case before the Supreme Court. And they were saying, the anti-choice people were saying that the doctors have to have privileges because for the sake of the women's health. Well, just to give you one important statistic for the Louisiana case, there have been about 3,000 abortions per year over the last 23 years in Louisiana, and there were only 4 cases of women needing to be hospitalized. So the whole issue of, well, you know, you have to have, the doctor has to have admitting privileges, that just goes out the window. There's only 4 of these cases in the past 23 years needed to be hospitalized. And in fact, any woman who needs emergency care, for whatever reason, can go to the emergency room at a hospital. So that was a false equivalency in that case. So in 2016, the Supreme Court, which was a different Supreme Court, ruled that was a false premise. And so they struck down that Texas law, saying that the doctors needed admitting privileges. By the way, this is something new I looked up. Admitting privileges are not easy to get. And that was part of what the case was saying. They were saying, oh, you can get these admitting privileges, doctors. What's wrong with you? Well, in fact, that is not true. Hospitals approve admitting privileges mainly to doctors who provide a lot of the money to the hospital. So in other words, doctors, OBGYNs, doctors delivering babies, they bring a lot of care into the hospital. Whereas abortion providers, doctors who provide abortions, do not, as you can tell by that statistic. 4 needed to be hospitalized in 23 years. So they deny privileges to doctors who do not bring in a lot of money. The other reason that they don't want to give admitting privileges to abortion providers is because they're afraid of protesters and security issues. So whenever they say that doctors can easily get hospital admitting privileges, that is a fallacy. So that case, the Texas case, was struck down by the Supreme Court in 2016. Now, the almost identical case, in fact, on all my reading said it was identical. The Louisiana case is bringing it up again, but they also know it's a different Supreme Court. In some of the reading I have done, there is a hope that they know where Kavanaugh and Gorsuch are probably going. There's a hope that Justice Roberts would provide the former Kennedy role on the court. But there is obviously no guarantee of that. There's a new little twist in the current Louisiana case. They are also stating in their case that they wanted, said that only a person, only the woman can bring a case, a pro-choice case to the Supreme Court. Well, other than Roe, which was in 1973, every single case regarding abortion that has been brought to the court has been brought by a doctor or by the clinic. So just precedent-wise, that, you know, them trying to say, this is the new challenge, that doctors and clinics do not have the legal standing to challenge an abortion law on behalf of their patients, the patients obviously being the women. So that's the new little wrinkle in this that they've added since the 2016 Texas case. So as I've said, I'm somewhat hopeful, but I'm also incredibly wary. And then the other issue that we're all talking about other than abortion, and which Arlene mentioned in her introduction, is the whole issue of contraception. And I'm just going to read you a very brief paragraph regarding contraception and what's going on legally. And it says, abortion is just one piece of the picture. At the same time as anti-abortion politicians have been pushing harmful state policies, the current administration has been carrying out a full-throated attack on reproductive health. Officials have tried to make it harder to get birth control by gutting the only national program for affordable birth control, known as Title X, tried to destroy the Affordable Care Act, which grants tens of millions of women access to birth control without a copay, and given bosses and universities permission to deny their employees or students insurance coverage for birth control for any moral reason. In fact, the Supreme Court will be taking up two of these issues later this year, meaning 2020, in cases about access to birth control coverage and health care coverage for millions. So that is kind of a brief and hopefully somewhat understandable explanation of what the Supreme Court will be dealing with. Another thing, the Louisiana case, when it first came up in 2014, and Louisiana is the one that's going to be before the Supreme Court, the district court ruled in favor of the pro-choice organizations. Then they appealed it, and the circuit court overturned that ruling, and which is unbelievable to all legal scholars, that they overturned a ruling that had already, the precedent having already been set. So that's why it came to the Supreme Court, because this circuit court overruled the district court. And so they're going as high as they can, and now it's now on the desk of the Supreme Court of the United States. So we'll be all looking to see what happens in the winter, and then with the ruling being in as I said, in the early summer 2021. So thank you for listening. I hope some of that was understandable.
So I'm Marti Keller, and in addition to my long time being involved with the Women's Federation, I think it goes back more than 20 years, and it was my privilege for at least 5 years to sort of carry the women's issues portfolio, both for the Women's Federation and for the Unitarian Universalist Association. I came into ministry, and I am a minister, and I've been a minister for 22 years, with a portfolio from Planned Parenthood. I was one of the first directors of government relations and public policy hired by a local state level Planned Parenthood. That was in 1979, when it was becoming clear that a lot of the action would not just be at the federal court level, as important as it is and as scary as it is, but that a lot of the attempts to roll back abortion rights and contraceptive rights would happen on the state level. So for 12 years, I worked in California trying to fend off some of the initial attempts to make it harder to get an abortion and birth control. I wanted to share that in my personal history as a director of government relations, my children had blood thrown at them. I was harassed, and my car was set fire. Because I was in the position I was in. So it's never been a safe or easy thing to do, but certainly worthy. And my hope is that there seems to be always another generation of people, women, younger women, who have been carrying on the torch of doing this kind of hard work, both at the clinic level and the level that I've worked. I also wanted to share, because I'm going to be talking about the COVID-19 virus and the impact on reproductive rights, is that I am the mother of a survivor of COVID-19. My 33-year-old son has been ill for 7 weeks, and while he didn't die, there were times that he was very seriously ill. So I don't take lightly the focus that there has been on providing services for COVID victims, but it's also important to realize that in the effort to prioritize, there's been a really cynical effort, as Linda Lu said, to make sure that some of the other essential medical services are not being provided at the same time. I also want to let you know, because I'm going to talk about it a little in terms of maternal health, that my daughter nearly died in childbirth 4 years ago and gave birth to a very premature child. In her case, she did not die, and her child survived because she's a white woman with good insurance. and good support, and gave birth at Stanford Medical Center and not in a hospital that was ill-equipped to deal with some of the really serious maternal morbidity and mortality issues that are out there right now. So that's the personal and professional framework I have for sharing with you a report from the Center for Reproductive Rights. And then I wanted to say that in the Women's Federation and the UUA's work on reproductive rights and justice, we are indebted to mostly the younger women who are in Washington, D.C., putting together the policies, doing the research, the National Center on Abortion Rights, the Center for Reproductive Rights, Catholics for Choice, so many of the organizations that are there in the Beltway, doing the work of putting together policy agendas and fighting this day after day. We couldn't do the work we've done as a grassroots faith community if we didn't have those partners. And I'll say that so many of the partners we have are younger women, women of color, African Americans, and men who think it's important to do this work. So I know that I feel personally indebted to all of the help that we've gotten over the years in doing the work that we do with the Unitarian Universalist women who want to know what's happening and what they can do. So I think it's really important to emphasize what Arlene said and what Linda Lu said about what is considered an essential service. Because you know that on the state level, governors have been saying what is essential, what can be open, what medical services can be provided. And there's been a real effort to make sure that what's not provided in some of the states is access to abortion care, access to good maternal health care, and access to contraception. The COVID-19 pandemic poses particular threats to poor and marginalized women who already were in a difficult situation, but are in a more difficult situation now in having to protect themselves from transmission when they're often working in jobs that put them in the front lines of exposure to the virus and who cannot afford to stop working. So they're already endangered every day by exposure to the virus. And then they have so many obstacles to taking care of themselves, both medically in general and reproductively. Some of it's due to lack of good information, some of it's due to lack of resources, but mostly it's due to lack of access to services in a country where access to services for so many women, and that's what the reproductive justice issue is all about, was already so poor. And at the same time, as Linda Lu and Arlene said, anti-abortion groups and some governments are exploiting this situation by denying women and girls access to abortion services, saying that these are not essential services. I live in Georgia where that's true, where the governor had said that access to abortion was not considered an essential service. So that causes individuals to seek out unsafe abortions, because women get abortions whether or not there are safe services available. And that increases the need, ironically, for hospitalization for post-abortion care when women get abortions that are not safe or legal. What I love about the Center for Reproductive Rights is when they put out information, they don't just fight what's happening, but they put out proactive statements. So as I share with you, I want you to listen to what I think we should continue to do, is not only say what we don't want to see happen, but to say what we want to see happen. So what is needed right now in terms of the COVID virus response to reproductive rights is we have to make sure that abortions are an essential health service, because abortions are a time-sensitive procedure for every woman who wants to have a safe and legal abortion in the first trimester. And it's prevented, for example, because there's rural hospitals that don't provide them. Because in California, for example, you're not able to travel from one county to another, that if we don't want women having abortions in the second trimester at a time when it's more dangerous for them and when it's uncomfortable for other people to think that women are having later abortions, we have to make sure that abortions are available early and in a place where people can travel to safely. Financial insecurity is even more prevalent now for women in terms of paying for abortions. one of the first things that happened after Roe v. Wade was passed was that the Congress made sure that no federal money would be spent on abortions. So it's been years and years and years since poor women could get subsidies for legal abortions. But in this environment, women who had previously been working are more likely, far, far more likely to lose their jobs in this pandemic because they were already in low wage, piecemeal, hourly jobs. So all of the economists are saying that women are in the front lines of serving us and making sure that we're taken care of. They're also in the front lines of losing their jobs and losing their health insurance. So there's travel barriers and financial barriers that need to be overcome so that abortion is regarded as an essential, timely service. Second, we need to remove the legal and administrative barriers to abortion, including not only medical abortion, but medicine abortion, to make it easier for women to use the medications that are now available for safe and legal early abortions by giving pharmacists more latitude, by allowing these decisions to be made in a timely manner through telemedicine. And if you have to have a medical abortion, to make sure that there are not so many visits which endanger you going out and the medical providers that need to serve women. So again, telemedicine, not having to come back and get an ultrasound like lots of states are now requiring, minimizing the number of visits and maximizing the convenience, both for the providers and safety for the providers and the women. And again, medication abortion seems to be one of the things that we really need to step up on during the COVID crisis. Make sure that under the Affordable Care Act, the minimum initial services package for reproductive health is honored, which includes prenatal care, OB care, postnatal care, contraception, emergency contraception, post-abortion, and post-rape care. So at the same time, the Supreme Court's been looking at the chip away. It is beyond chip away of abortion at this point. It's just wholesale overturning it. They've also been chipping away at the accessibility to contraception by employees' health plans, by exempting more and more employers on faith grounds, and now actually on any kind of moral ground from having to provide contraception. So in this time of emergency, it's especially important that those basic essential medical rights are retained. We need to guarantee access to quality, respectful maternal health care for women who are continuing their pregnancies. And what's happening now is, I think a lot of you know, that women are giving birth to their babies alone without their loved ones, and alone without people that could have advocated for them to make sure that they get good quality maternal health care and don't die giving birth to children or afterwards. And again, disproportionately, Black women and Latino women and Native American women die in childbirth in this country. Lots of ways we don't know why, but certainly access to good quality health care, good insurance that allows for good testing, and good advocacy for women as they give birth to children. So the specter of many women giving birth alone is truly terrifying to those of us who want to make sure that all women have safe childbirths. And then again, absolutely access to contraception, including emergency contraception, especially in this financially tenuous time. It's especially important that women can make their own decisions about whether to have children and whether to not have children. So those are the things that the Center for Reproductive Rights are pushing us to advocate for. And that's what I love about it. It's not always a fight. We know what's needed. We just need to make sure that it happens. So that's my initial sharing.
About having access to hospitals as a sort of pre-requirement for women to get abortion. And so many rural hospitals currently are owned by the Catholic Church. They have been buying up small rural hospitals throughout the country. And we all know that they do not believe in abortion. And so it's becoming harder and harder for women, especially in rural communities, to find a place to have an abortion, and they have to travel many hundreds of miles currently in order to find a clinic that they can use. So
Thanks for that, Arlene. Absolutely. One of the things that I think about when we're thinking about reproductive justice more broadly is a program that the Women's Federation gave a grant to a few years ago. And well, it was a church that was trying to spin off into a nonprofit. They were donating menstrual products to food banks and shelters and that kind of thing. In that, those are the kind of things people don't think to donate, and those are the things that are both expensive and they're still taxed. And access to menstrual care is a huge health issue around the world, but it's still an issue in the U.S. as well. So that's, you know, one of those little things. So they're in central Pennsylvania, and they're expanding outward. So I think it's just shapeofjustice.org. If you want to look them up, they're really fabulous. They've learned a wonderful model, and that it's the piecemeal, it's the chipping away. It's like there was I think it was in Ohio, there was a move to make menstrual products tax-free on one of the, you know, biannual sales tax-free days in Ohio, I think. And a lawmaker was like, no, women would hoard these things. They would buy a year's worth or half a year's worth. And it was just fascinating to me. Just really like someone who really needs to save that tax money cannot afford to buy a month's worth, hardly, of menstrual products. And so, and really, why would it matter if someone bought 6 months worth of tampons? And then getting into contraception with the Catholic hospitals, I presume that's slightly easier to obtain than an abortion, but it's really it's all around. It's the health problems, the health care problems within the U.S. in general. I think that the same issues, the same problems lead to folks being more susceptible to the COVID-19 virus. That poor environmental conditions, low income and bad insurance will lead you to have worse health. It's difficult to be poor. You have to be thinking all the time about how much money it takes to exist. And so it's really hard to stay healthy that way. And so communities that are already oppressed, that are already having a hard time, that are disenfranchised in many ways, are extra hard hit by these things because of the health problems that they've incurred, because of their forced poverty, really, is what it boils down to in a lot of ways. The difference I see these days after COVID-19 especially, the arguments to open back up the economy, to value dollars over people, is really even more stark than it was before. And it was definitely there before. So when we came up with some of our questions for the panel, it was a different circumstance. We have kind of some general questions, and I, in general, like to start with the harder, start with the most difficult, and then end with the happier, the lighter note, as it were. So I'll read these kind of in reverse order of how we'll view them. So specifically with regard to reproductive justice, where do you see hope? Where can UU women connect? And what do we most need to do right now? So these are some of the thoughts that I have, and I imagine our audience as well, what y'all are seeing in other realms and people and congregations. And I just to hear some of your wisdom about what to do.
I think that right now it's all about voting. I know that there's one group of, it's hard not to be partisan, it's an election, but there is one group of people that are totally fixated on continuing what's going on because they've gained so much in terms of what Linda Lu said in the court appointments. I mean, it's been a bonanza, people that are appointed for life. And so we can't emphasize enough the fact that that's the leading agenda. And so we have an opportunity to really push that. It's clear. I guess what I'd say is that there's clarity to be had right now. There's clarity in why some people are wanting to support candidates who don't look logical to them because their gain has been so tremendous in terms of restricting access to reproductive rights. It's also clear what is happening when people don't have access to health care because COVID has made it so clear. So what I say is we've got an opportunity like never before to attach these clear issues to voting. And so what I would like to see, and I think we could do better in the UU the vote, is to really put some of those issues, those women's issues, those reproductive rights issues, reproductive justice issues in the forefront to encourage people to encourage each other to vote on that as well as some of the other things. So I think that it's, you know, that the speaking points are going to be clear, I think are clearer than they've been in a long time. It's really clear what's happening. And also that is happening on the state level, as I said. So, you know, get involved in your state. What I want to say is that no matter what, the action is going to be happening, except in the court appointments. There's not going to be that much happening in Congress. It's going to be happening on the state level. So I think getting behind UU the vote and really working hard on the state level. And I hope that will give some impetus to some real action by UU women.
As white women, I would like us to give a big shout out to Sister Song, the African-American organization that really brought reproductive justice to the forefront. Prior to that, it was choice or reproductive rights or whatever. And it has broadened the agenda tremendously. And I just wanted to state that Sister Song has been leading that effort, I think since 1983, when they had their first conference in Atlanta. So thank you, Sister Song. Where I find hope is with the young women that I talk to who are aghast at the history and have really, a lot of them don't have the sense of the history, but once they find out, they just, they get very activated and animated. And I think we're going to see a tremendous upsurge in young voters this election who will speak their mind and who will vote their conscience. So I'm really quite excited about that. And I think that this is a very important election for many different reasons, but certainly for the whole issue around reproductive justice. And I encourage everyone to make sure you're registered, make sure your registration is okay and that it's not out of date for some reason, and that you know where your polling place is. And if you can't make it to the polls, apply for an absentee ballot well in advance so that you can vote absentee. And I believe you still have to get it notarized in some states if you vote absentee. Certainly in this state you do, but maybe in other states you don't have to have your absentee ballot notarized. But it is so important, and I totally agree with Marty, the fact that voting is probably the most important thing we will do in November to make sure that our reproductive issues and reproductive justice will continue and that women will not be left by the side of the road.
I echo what both Arlene and Marty said about voting. My little spin on it though, last time In 2016, I was hopeful. And everyone I talked to, when they said, oh, I might not vote because I'm just not crazy about Hillary. And every time someone would say that to me, I'd say, first of all, you don't have to go out to dinner with her. You don't have to be crazy about her personally. I said, and second of all, I have 2 words for you: Supreme Court. And I said that over dozens and dozens of times to people for the 2016 election. And obviously, my urging, I mean, she won the popular vote, but we still lost. Anyway, I'm more hopeful this time, but I'm also apprehensive because I thought all these major groups were going to come out the last time and didn't. So I'm kind of on the fence with the hope versus the apprehension. Just going to do everything I can. And I agree with the absentee vote. We can in Massachusetts without notarized. And I'm going to vote absentee anyway, just in case. I mean, I could get, the flu on election day. I could be, something could happen to me. So I'm going to vote absentee no matter what. But I do think it's very important. And once again, my 2 words, Supreme Court, like all of you said, lifetime appointments. And again, it's not just the Supreme Court. It's all these hundreds of judicial appointments that have occurred over the last 4 years. We can't afford it. We will not be living in the same country. This will not be the same country anymore. So on the fence with the hope and the apprehension.
Absolutely. One of the things, thinking about voting, actually here in Waco, our city has been pretty proactive about COVID restrictions, and they closed down schools early. They issued a shelter-in-place order before the state did. And one thing that we had to really push for was city elections are the first Saturday in May. And so it was a bit of a struggle to get them to push the city elections. The governor of Texas stated that if you weren't going to have your regular city election in May, which some cities do, some cities don't, then it has to be in November on regular voting day. So some of the activists in our community are trying to get local elections, get a waiver from the governor to do local elections in July when our runoff elections are to be held. Well, and this brings it back to a little bit to voter suppression, that our current city government is, some insiders. I know them all personally, and turnout in local elections is shamefully low. And so I think that our city leaders were a little nervous that so many people would be voting if they were going to do their city elections on big election day, 2020 voting against Trump, or whatever, we're in Waco. It's Trump's going to win Waco, but it really is all about these local and statewide elections. And so to remember and that's really where the leadership has been with COVID-19, in my opinion. This leadership has, I've been very proud of my city leaders for that reason, and that those are the folks that are affecting you day to day, me day to day, our children, our families, that we really also need to think of, because that's something that people forget. Tons of folks go into the November elections. We had record numbers of, off-year elections in 2018, sure, but literally, our mayor was elected with 300 votes in a town of 130,000. So it's all over the place. It's very interesting to see where to be nervous and where to plug in, and much the same that we want to bring to raise up our younger leadership as well. You know, it's people start out in city government and go into state government and whatnot, and so these are the kind of people that we want to lift up and support. And so there are a few organizations that help, some PACs out there, some new PACs that are ready to support. District attorneys is a really big one too, for with regard to incarceration and looking more to the reproductive justice angle, going beyond abortion rights, is the ability to have a child and parent a child without worrying about that child being killed or going to jail by the time they're 20. And so those factors are hugely determined. It's district attorneys and state's attorneys who are really the people that you need to look out for in your city election, most especially. We ousted a stinker recently. I'm pretty proud of that. His successor, I'm not super excited about, but he's eons better. So, and he listens in a way that the previous didn't. So it's really nice. So I encourage you, especially, you know, no matter what size your town is, to get to know your people. Like you know, I have my representative's cell phone number. You know, it's a small town, but that make sure that your city leaders are accountable to the people they represent. And that even if you're in a place that is mostly anti-choice, Waco is one of them. I moved here from New York City, and so that was a huge difference. I'm from Texas originally, but coming from, you know, that liberal northeastern bastion back to Texas and to a smaller town in Texas, not one of the bigger cities, you know, it was a real wake up again. You know, I was hearing these things, but here I am right in the middle of it. And so that was one of our reasons. We had a lot of reasons for moving back to Texas, but it, you know, it was like, okay, we need to go be the dissenting voice in this state as much as we can. I think Arlene can feel me up there in Tulsa. It's a struggle.
I wanted to add one more thing. The importance, if you don't know who your representative is or who your state senator is, or even who your congressional representatives are, call your election board or get online to their website, and you can find all of that information at a moment's notice. Know who your elected representatives are and be ready to email or call them for any or all reasons, because they represent you. And don't forget, you have as much right as anyone else to call them out, to talk to them, to go to their town meetings, any of that. And it's just so important to also support your Planned Parenthood organization, your state National Abortion Rights Action League, if you have a state organization, and just be aware that there are lots of things that you can do as an individual to make your voice heard. And don't be afraid. Be ready to stand up for your rights.
I think one of the most important reproductive justice things we could do as allies is to continue to monitor what's going to happen again in many states, and that is shutting down polling places in largely African American communities, taking people off the rolls because they didn't vote in one election. This time around, just to tell you a word of caution, is that I just turned in my absentee ballot for the primary, and it requires 2 first-class forever stamps, not 1, but there was nowhere in the instructions that they said that you needed 2 stamps. And so who knows how many hundreds or thousands of ballots will be thrown out. because number one, they didn't pay for the postage, which was up in the air. That's a justice issue, a reproductive justice issue. And then many people had no idea they had to put 2 stamps on. It seems like a small thing, but that's what's going to suppress our hope. And I think one of the best things we can do as allies is just be fiercely available to those people who are so obviously being shut out of the electoral process.
Appreciated the reminder about voting absentee. In Texas, I'll have to look up if it needs to be notarized, because I plan on it as well. Because before the city decided to change their elections, the county was advocating for it. And we're the county seat, but the county itself is larger, and that the county was advocating for it and the city was anti for a while. There was a week where we were just really not sure, but the county's the one that runs the elections. And so, we, it was like, okay, if we just all apply right now for absentee ballots, maybe they'll be overwhelmed and we'll have to do it. They can't do it all by mail, it was May 2nd. So the decision was made in mid-April. It really wasn't very far ahead of time. And what I didn't see was much publicity, because of course so few people vote in the city elections. They didn't have to say, guys, don't vote today. Once that decision was made, from the few activists that I know, I didn't hear another thing about it. So it's the little things, the little access, the little obstacles, the death by 1,000 cuts. It's the stuff that wears you down. It's designed to wear us down. And so we do our best as an organization to support you and one another, and I do my best personally. And so one of the things that we've talked a little bit about, I would like to read both the definition of reproductive justice from the National Black Women's Agenda, and we, as the Unitarian Universalist Women's Federation, recently released a statement on COVID-19. So I wanted to read those for y'all. We'll put the text up for you as well. And we have a little bit of time, so if Marti, Arlene, or Linda Lu want to weigh in or highlight any particular piece afterward, you're welcome to, and you're welcome to pass as well. So from In Our Voices, reproductive justice is the human right to control our bodies, our sexuality, our gender, our work, and our reproduction. That right can only be achieved when all women and girls have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. It is this vision that propels this new initiative, and by that is the initiative, the In Our Own Voice, National Black Women's Reproductive Justice Agenda. And so thinking about all these things as the Women's Federation, and thinking about working toward these things and working toward reproductive justice, which is, really just trying to make everything better for women. And so having all of the rising tide lifting all the boats. As Unitarian Universalists committed to gender equity, we, the UU Women's Federation, believe in justice, dignity, and compassion for all. Universal access to affordable and comprehensive health care is a moral imperative. As we have witnessed the unprecedented spread of the novel coronavirus that causes COVID-19, the UU Women's Federation is committed to advocating for a United States where catching a preventable illness and seeking medical care does not bankrupt a person. The Women's Federation demands a world where a living wage, paid time off, shelter, ample food, and adequate health care and child care are not markers of privilege, but rather a right of any and every human. We demand a new normal that not only addresses the virus, but interrupts the underlying oppression that has made this pandemic so catastrophic. We honor all the essential workers who risk their lives to ensure that the rest of us can be with our families and loved ones. and we insist that they be valued, not only in words, but with fair compensation for the risks they are taking on our behalf. This new normal affirms the dignity of detained and incarcerated people, dismantling the systemic, cruel, and unusual neglect in prisons. We seek a system that does not cause women, trans, and people of color communities to be disproportionately harmed by pandemics or other crises. The new normal includes a healthcare system that allows for accessible mental health care, safe and affordable housing, nourishing food, and adequate time off work to maintain health and safety for ourselves and our loved ones. And I'm really proud of that. We had a consensus as a board, and it just, this pandemic has really crystallized all these feelings for me personally, and my board members as well. Well, once again, this is Claire Sexton. I thank everyone for being here. I thank everyone for their patience. Marti Keller, Arlene Johnson, Lu Burciaga, all of our fabulous attendees, audience, and our original presenters, Suni Chandy and Lexi White. One of the ways to be connected is to connect with those organizations, the National Women's Law Center and the National Black Women's Reproductive Justice Agenda, along with Sister Song that Arlene mentioned, and just lifting one another up is more than many will do. And so even that is a radical act.